My name's Andrew, and I used to make videos a long time ago on YouTube when I was first coming out, and it really helped me, and it helped me always have someone to talk to. And now in my life, I don't have time to go and see a therapist. I don't have a car. I have two part-time jobs and a dog to take care of, so I don't really have a lot of time to do the things that I need to do and to reflect on myself. And I'm just over 2 years on hormones right now. I started hormones on July 21st, 24th, somewhere along those lines. I realized that I never really paid attention to myself during my transition. I never really looked at myself in the mirror. After about 7 or 8 months, I stopped paying attention to all of that. I got very depressed. I spent a lot of time smoking pot and just drinking all day. I dropped out of school. I didn't notice things happening. I didn't notice my hairline receding. I didn't notice the rest of my beard coming in. I had it grown in a lot, so I never trimmed it. I never paid attention. I had really bad acne all my neck. It wasn't even like little white head zits that you could pop. It was just those like hard under your skin, never ready to pop zits. So I tend to just keep it filled in. Now I'm at the point in my transition where I need to focus on getting my top surgery. My back is killing me every day. I switched to the GC2B binder just because I liked it better, it fit better, and it was more comfortable. But now I'm stuck between sizes, so I've got a medium that is too loose in the chest part, and I've got a small that, it crushes my ribs more. I have to pick comfort or confidence every day, and it's not good. But I'm realizing that I'm not mentally stable enough to handle surgery. I don't know what it's like to be put under by anesthesia. I'm too afraid to go and get my cavity looked at by a doctor because I know that they're going to have to pull it or do something and knock me out, and I refuse to do that. I'm too afraid to do that. So I don't know where I need to proceed, and I feel like venting and talking about it again and spending a lot of time on YouTube and listening to other guys transition might help me feel a lot like normal again. Do you ever feel like you've gotten used to, well, my chest used to be a double D. The last time I had it measured at an actual store was a double D before hormones, and that was years and years before. That was in high school, and I started hormones going into my sophomore year of college. There was a lot of time for it to grow, and I did gain weight, so my chest was probably around an E or whatever is one step larger than that. I was very uncomfortable, and I hated it every day. I wouldn't go to my dance classes. I was in theater, and I wouldn't go to my dance classes. I would under-participate in my acting classes because my chest was always a physical reminder of what was there. I could look down and just see something that's there that's not meant to be. It just felt wrong. It felt like wearing a backpack on the front of your body all the time and having to hide it. I always kind of held myself back because I felt like at the end of the day, I always know that my chest is there, and that's always something that I can't get past. But now, I can wear binders and I can't even tell. I can walk around the house shirtless, which I never thought I'd be able to do. I can cover up my chest with my hands, and it completely disappear. It's just I've got a lot of extra skin, which is really uncomfortable to me because I've always wanted to just look cis. Like, I want to be trans without having it be obvious is the best way that I can phrase that without taking 15 minutes to explain it. I want to be able to be my genuine self and not have anyone question if I'm male or not. I don't know if that makes sense because inside I'm very fluid, but outside I want to just show masculine. I don't know where to do that comfortably, and I feel like my chest has always been the one thing that's in my way of letting me do that. And now I've gotten comfortable enough with my chest where I can adjust my binder like during the day, and I don't realize that I do that in public now. And I never once would have done that before. But now I do, and I do it without realizing it. Like right now, I'm adjusting it. I don't know how to proceed with these thoughts because I'm far too afraid to get surgery. I've put it off for 2 years. I could have had it for a year and a half now, but I've been putting it off because I'm too afraid. Plus, my insurance is being a pain. And my doctor's office and my insurance goes back and forth and lies to me, but that's a whole nother thing I'll talk about. So I'm just saying, does anyone else feel even slightly like this, where you know you want surgery, you know you want the end results, but like I'm far too afraid to put myself through the process of being cut open, taken apart, put back together in a way that's never naturally there, risk losing my nipples, risk any other health complications, and be in absolute pain and agony for wearing the tight post-op binders, not being able to breathe right, not being able to move my arms, not being able to leave the house, going completely stir crazy. Is it worth it? And always I will say yes, but I don't think I can actually do it. And I need to mentally get there, and I'm not. And hopefully talking about my transition again more and being more present with it will help me normalize it. There we go. Hopefully this minute's like 10 minutes long already, so hopefully I'll be able to cut it down. If anyone ever has any questions about my transition or anything, feel free to ask me. I'll do my best to answer. And if anyone has anything that they want me to talk about that they feel, please let me know and I'll share about it. I really just want to vent about my transition and normalize it, or at least talk about it and come to terms with it. And I feel like this is the best way that I can do that. All right, I gotta go to work. See ya.